All new this morning, a closer look at artificial intelligence in healthcare.
Hospitals say the technology is carefully vetted and closely monitored. Our Jasmine Monroe explains the goal isn't to replace doctors, but to support them.
Artificial intelligence is making its way inside of hospitals and exam rooms across the country. From scheduling to diagnostics, the technology promises to make care faster and more efficient, but not everyone is fully comfortable with it.
So right now, it's mainly being used kind of on a logistics end, right? So the nursing supervisors, from a nursing scheduling standpoint, they're using it to help fill in schedules, or if there's a call off to get the right person where they need to be.
Dr. Eric Troup with HCA Memorial Hospital says much of the current use is behind the scenes, coordinating CT scans, alerting care teams, and improving workflow efficiency.
There's both good and bad when it comes to AI. What are some of the good things that you see as you learn more about the systems?
So the good things that I see, especially for your more rural areas, is going to be access, availability to information. As we all know, when you're not at the big university center, sometimes it takes time for that to get there. But we can get that information into the hands of those physicians to those patients. One of the tools that I'm most looking forward to, let's say, is the kind of AI scribe to help us with our note taking, to allow us to spend more FaceTime with the patient versus being tucked behind the computer. So they'll actually listen to the conversation you have with the physician and kind of synchronize with the medical record and actually write the documentation and the note for the physician.
That ambient listening technology would create draft notes for doctors, cutting down on screen time and potentially giving physicians hours back on their day.
And it'll make more efficient your physician, more FaceTime, listen, take away the 20 minutes that they writing the note, and maybe alert them to newer medications, a different medication based on data that your physician may not have available to them at the time.
But there are concerns, especially when it comes to privacy and accuracy. Hospitals say systems are rolled out slowly, carefully vetted, and require patient consent.
That's why the physician needs to be that last check mark, that last safety box, before we would just give something.
Dr. Troup says AI won't replace doctors, but it can fill gaps, especially amid a nationwide physician shortage. The key, he says, is balance, trusting the technology, verifying the results, and keeping patients' safety first.
Well, hospitals stress AI is carefully tested and monitored. It won't replace doctors, but it can make them faster, sharper, and more efficient. That closes our series on The Revolution Will Be AI. For First Coast News on your side, I'm Jasmine Monroe.